Welcome to Derminside. In this video, we will talk about Verrutop, a treatment used for periungual warts, condylomas, and plantar warts. This treatment should not be used in pregnant women, in children under 6 years old, or on the face. Verrutop contains nitrogen complex, mainly acetic, lactic, and oxalic acid, which chemically destroy the wart tissue through protein coagulation. Clinical data show about 90% effectiveness, with most patients improving after 3 sessions. Now, let's see how it's applied. Open the box, break open the cardboard, and you will find the instruction leaflet. Under it, there is a small cardboard envelope containing thin glass capillary tubes, along with 4 ampoules. The application is simple and follows 4 steps. First, break the ampoule. Then, immerse the capillary tube into the solution. Next, hold the liquid inside by placing your finger on top. And finally, apply it directly to the wart. Apply a small quantity adapted to the size of the lesion without excess. You can repeat the application if needed after 30 seconds. The application is usually painless, but a mild burning sensation may occur for a few hours. The wart then becomes brown and finally dark brown over the following days. After about 15 days, the tissues dry out. This is called demummification. If needed, the treatment can be repeated after 2 to 4 weeks. After application, avoid washing the area for at least 4 hours. Avoid applying alcohol. Avoid covering it with a bandage. And finally, avoid scratching the treated area. In conclusion, the main advantage of Verrutop over treatments like cryotherapy or bleomycin is that it is non-invasive, leaves fewer scars, and does not require a bandage. If you found this video helpful, don't forget to subscribe to Derminside.